Namaste. Our chairman, Dr. Reddy, Dr. Srinath Reddy. It's kind of interesting that we have two fantastic Dr. Reddys on the table. Thank you for the support to the vision. Ladies and gentlemen, members of the media, our knowledge partners, our partners who've really helped us put this together, my colleagues at work. Again, thank you all so much. This is just a beginning of something which promises to be historic and path-breaking. They say leadership is defined in many ways, and one would be to say that leadership is actually mobilization towards a common goal. And I think health should have happened a long time ago, but I'm glad it's moving in that direction, has become a common goal for people who are really passionate about it, who really want to make a difference, and those who are very concerned about it. Because, you know, as responsible media, I know that you all report terrorism to a large extent. But the onset of the non-communicable diseases, diseases which are slowly creeping in to literally take over the world and mankind, is actually a larger act of terrorism, but something which I think the human race can intervene and make a difference. So I think for the first time, we've managed to put together a great army of people who are really coming to us with a collective vision and trying to see what is it we can do to address, to start with a few problems and maybe take it on as an ongoing initiative, to try and see if we can make strong, doable recommendations which are short-term, which are long-term, to start with maybe to the governments, not only in India, but in the neighboring countries and in the African regions, and maybe become a global example for the rest of the world. And I think that's really what the whole thought process behind it is. I'd like to warmly welcome and thank the representatives of the 5 August industry bodies who very readily said that we will support this common national cause, and I'd like to read them out. It's again by alphabetical order, not really by importance. So we have the All India Management Association, the IMA. We have the Confederation of Indian Industry, CII, the Federation of Indian Chambers of Commerce and Industry, FICCI, the Indian Medical Association, IMA, and the newest and the youngest, the Healthcare Federation of India, Nat Health. So can we give all of them a big hand and a big thank you for being here today. And then we know and we understand, and the great philosopher Plato has said that knowledge is the food for the soul. So nothing can happen unless there's a huge bank of knowledge supporting anything we set out to do. And our knowledge partners are of global repute, who are respected worldwide. And we have Bain & Company, KPMG, McKinsey & Company, and PricewaterhouseCoopers, PwC, who have agreed to be our knowledge partners. So thank you all for being there with us. This would not have happened unless Dr. Srinath Reddy, we reached out to him, and PHFI has been respected globally for the knowledge and the difference they've made in the way healthcare is delivered now, not only in India, but to the neighboring countries, and become an example for countries in the rest of the world. So when we reached out to Dr. Srinath Reddy and said that Dr. Reddy, Dr. Pratap Reddy has a vision to put everyone together and come out with recommendations which will make a difference, can you please give us the technical support, the knowledge support, and help us steer it in the right direction? So we have his presence here, which really gives it credibility and value. This groundbreaking coming together for this initiative actually represents a confluence of about 382,000 members, which is the combined strength of all these August bodies, and a collective wisdom of over 359 years. So, that's the kind of knowledge and people we have together. And this has never happened before. So to all of us, I think it's historic. We're also getting some fantastic speakers, luminaries in their own field. Some of the names we have is Dr. Victor Zhao, Lord Nigel Crisp, Mr. John Brooks, Mr. Ami Rubin, Mr. John Adler, Mr. Juan Thompson, Mr. Krishna Uday Kumar, Dr. Rajiv Doshi, Ms. Swati Piramal, and many of them who've really made a difference either as a scientist, as a doctor, as a healthcare economist, head of NHS. So we've got really people from all over. We've got health ministers, health secretaries from some of the neighboring regions who are going to be part of this. The focus will be on 4 crucial areas to start with. Number 1, the biggest problem being the control of NCDs through primary and preventive health care. How do public, private, and people partnerships work in the future? How do we handle talent? So talent, fast forward, upskill and upscale, and innovation for universal access. Because if we do not innovate in the healthcare space, I think we're going to be left far behind. So that's really what it's going to be. The 5th session again promises to be extremely exciting. It will have healthcare providers within India and outside India talk about the future and my vision for the future. How can the future be maybe nearly perfect, but that's what the 5th session promises to be. So I think we're going to have a very exciting 2 days, which is the 3rd and 4th of March. We kind of kept it quickly because I think if you prolong good things endlessly, we may not get the best of it. So we had literally about 3 to 4 months to put together, but with the kind of enthusiasm, support, and knowledge we had, and people being so forthcoming with their time, effort, energy, it promises to be a historic, a path-breaking, and a truly collective vision for the future. Again, ladies and gentlemen, thank you for being here today, and for all our partners, thank you for being part of this. Thank you.
Good evening. It must be a relief to be at a press conference or a media event where 2 Reddys are not talking about Telangana or Seemandhra. I must indeed congratulate Dr. Pratap Reddy Garu for having convened a major alliance on healthcare, which is actually looking at the future of healthcare in a country where we have failed to deliver on many of the essential health needs of our population. We see the consequence of that neglect of many years in the poor health indicators in very many dimensions. So whether it is related to maternal and child health or immunization coverage, or in the case of the number of people with high blood pressure and diabetes who are not even detected, leave alone well controlled, the statistics are numerous. And the demand for health services is rising rapidly, as indeed are the costs. And if 60 million Indians are impoverished by unaffordable health care each year, that is an avertible tragedy that we must address. And that is why there has been a wide articulation of the need for universal health coverage, wherein we provide every Indian citizen access to their essential health needs without financial costs which are forbidding. Obviously, when we are talking about an efficient healthcare system, we are really talking about access, quality, and affordability, and which must be delivered with effectiveness, equity, ethics. And it is to create this kind of a system from the relatively fragmented components that we have in this country that we need a unified vision, which we hope this alliance will help to foster. Frankly, there are many stakeholders in the area of health, whether it is the civil society, which acts and advocates on behalf of people's interests, or the public health community, which brings in evidence and expertise into the area of planning and program development, or the government, which actually holds the reins of the major national health programs, or the private sector, which has become a major player in the delivery of health services. All are important contributors to the design and delivery of healthcare in this country. Unfortunately, each of these vital groups speaks in isolation, and we have each of them speaking to their own membership, to those who are already converted to a particular line of action. On the other hand, unless we actually have a process wherein all the groups actually talk to each other, talk with each other, and evolve at least some level of concerted action, we will not be able to advance the health agenda of this country. Therefore, it is very important that we create platforms for consultation, where at least there is a conversation to begin with, which can potentially lead to consensus and further upon to collaborative action. And it is unrealistic to expect that all perspectives will be aligned automatically. There would be differences. There have to be differences. But there is also a great area for collective action and consensus building on important areas where such a consensus is possible. And in order to even explore those opportunities and to open up pathways of action which have the health agenda of this country uppermost in the priority list, we need to have platforms like these. So the Public Health Foundation of India, which is an independent think tank, which is committed to building broadband capacity for public health in this country through education, training, research, policy support, advocacy, and health system strengthening, is happy to partner with all groups who are engaged in the effort of exploring in depth the issues and challenges related to the health problems of this country and are trying to find solutions for it. And therefore, we are happy to be a technical support group which extends its technical services to this healthcare alliance. And we will be, of course, as is our mandate, be happy to provide the most objective evidence, and we will be happy to also argue the case when there are some issues where we believe the course needs to be corrected in one way or other. So it is that level of independent intellect, but unbridled passion to public health that we also bring to this effort. And I believe that we ought to be able to work together on issues like primary health care. Primary health care has been one of the major areas of neglect in this country. It has been the Achilles heel. And unless we strengthen primary health care, both in rural and urban areas, in design as well as in delivery, we will not be able to bring our people to a higher health status. And for this, we need to ensure that not only primary health care is designed properly and delivered through the strengthening of the government health system, we also ought to be able to bring in the large number of other players who are potentially participants in this primary health care. And here, while public-private partnerships are often viewed with suspicion, let us recognize that there is a role for that too. The National Blindness Control Program could not have succeeded if there was no participation of private doctors. The National Tuberculosis Control Program cannot succeed if multidrug resistant tuberculosis is not prevented by the large number of private physicians who are treating these patients. So we need to bring together all players in a purposeful manner, even in some of the important areas related to national health programs. I define PPPs as partnership for a public purpose. And as long as the public purpose is identified and the deliverables are clearly defined and accountability is affixed for all the partners, I think we should be able to work together as teams. And to identify to what extent we can work independently and to what extent we should work together, I think that is a matter of debate and dialogue which some of these platforms should be able to engage in. And primary health care now would have to be substantially delivered through non-physician healthcare providers. We can't make it doctor-centric entirely. Technology-enabled non-physician healthcare providers are absolutely important, and in many countries, they have successfully helped to manage not only HIV/AIDS, but also diabetes, high blood pressure, and others in primary care. Of course, physician supervision intermittently is required, and with technology, we should be able to bridge the gaps, be able to provide physician advice to these frontline health workers. But for that, we need innovations, and therefore, appropriately, innovation also has been chosen as an important element of this consultation. So primary health care, innovations, and NCDs, as has been said, is the major rising threat in this country. It is no longer a problem of the rich people. Heart diseases, cancer, all of these are affecting the poor in larger numbers, and if we do not do something to prevent it, by managing, by health, not only health education, but by detecting and managing risk factors in primary health care before they develop into complications that require tertiary care or secondary care, we would have lost the battle. As cardiologists, we can tell you that all affairs of the heart are expensive, not merely in a poetic sense. And therefore, we ought to be able to ensure that we can detect and control things like high blood pressure and diabetes in primary care very early on. So again, NCDs would require effective referral linkages, effective care at all levels, and we have some of the best technical expertise now in tertiary care, but we ought to be able to bring that level of quality also to primary care and secondary care. So this is again a very important area. So each of the areas that have been chosen for this consultation are absolutely pivotal for India's health agenda. And as I said, it is absolutely a requirement that we bring the best of science and the best of public health knowledge into this area of debate, where we ought to be able to collectively decide on where we can work together and how we can advance the agenda of health in India through collaborative action. The Public Health Foundation of India is happy to be called upon as an independent technical support group whose varied expertise in these areas will be certainly put to test when called upon, but we hope we will be ready for the occasion in terms of providing the required support to those who are committed to act in public interest. And we look forward to this consultation with international participation, but also wide-ranging Indian participation, providing us sufficient impetus for action in the days to come. Thank you.
Thank you, Dr. Srinath Reddy, for putting at large the healthcare of the nation, and of course, the great work that Public Health Foundation has been doing, and our clear objectives. I think it's towards this goal of getting a clear objective of health of tomorrow is where I think a landmark association has happened. Thank you. Thank you all the big industrial organizations of the country, and more importantly, the knowledge partners. And equally, I think we owe to Public Health Foundation and Indian Medical Association, but more importantly to the thought leaders that have agreed saying, if you think that we can do something to bring better health to peoples of the world, we are with you. So I think we are very, very thankful for the numerous international faculty and the national faculty who have agreed to participate in discussing the 4 or 5 major issues that Indian healthcare is facing in the 21st century. You know, first we must all feel happy that 21st century is not all that bad, because we have evolved. We have evolved so that our people don't have to go abroad. The quality of healthcare that's delivered in our country has been remarkable. not only for our people. A large number of countries from overseas, from other places, are coming here for help. Recently, we had a conference in Chennai. It's called Cancer Conclave. The objective was not to discuss saying these are